very exciting to be here. I'm Jeffrey Bumpous. I'm the Dean of the School of Medicine and Executive Vice President for Health Affairs for the Health Sciences Center at the University of Louisville. And this represents our inaugural meeting with our alumni, something that I hope to do on a regular basis, hopefully a biannual or annual basis, and we'll kind of judge that by interest. We're also recording the proceedings tonight, and we hope to make that more broadly available for those who couldn't attend. I would like to give a shout out to the Louisville Alumni Medicine Association. They've really become very dynamic and very active. Current presidents, Dr. Stephanie Sufer and Vice President Dr. Krista Brooks Haror, have been really instrumental in working with the group, and it's been very exciting. In fact, this past weekend, I spent time at our School of Medicine alumni reunion, which you realize we have designated years any given year, but we had a record number of alumni there, over 300 held at the Omni. It was accompanied by a CME event this year, and it was really well attended, and we had great levels of engagement with the alumni. Being an alumni of the class of 1988, I hold the School of Medicine very dear to my heart, and was really honored to be named EVPHA and Dean because I am deeply vested in the success of both the School of Medicine, the Health Sciences campus, and the university at large. So with those introductory remarks, I would also say at the end of the address, I will address some of the questions that were submitted previously, and if we have time in the Q&A box to take some questions from the audience, we'll also endeavor to do that as well. So let's move forward then, and at first I want to talk about some pride points. And by pride points, I think these are some things that I'm very proud of that have occurred over this last year during the time in which I was an interim dean and vice president, but have continued on and flourished in the last few weeks and month as I've been the permanent EVPH and dean. So one of the things I think that's most exciting is we have received the largest appropriation from the Commonwealth of Kentucky and legislature for a new building, a $280 million award for a collaboration hub building. And this building is so exciting because it's going to house a new state-of-the-art simulation center that can help with teaming and work with education in both learning, research, and community engagement. So it's also going to increase the wellness of the campus by providing increased dining areas and dining spaces and options that are healthy, and centralizing some of the services that are in the health science campus. Many of you who trained in an era like me would recall there being a School of Medicine and a School of Dentistry, but on the health science campus at the present time, we actually have four schools, which include the School of Medicine, School of Dentistry, the School of Public Health and Information Sciences, as well as the School of Nursing. So we've grown considerably in our mission, and we're really looking forward to this new building. In addition, we have recently received a significant center grant award from the National Institute of Health as part of the NIH Idea State program. And this is a CTRD grant for $11.5 million, and it's renewable. And this is helping us establish the Kentucky Center for Clinical and Translational Research. This will provide infrastructure, startup grants for young faculty, and really will place us in a new category with elite medical centers and research universities around the country. Additionally, we have a $16 million HRSA grant for urban and rural undergraduate medical education. This leads into some of the questions that were actually submitted earlier, is what are we doing about primary care, and is primary care still a priority? This grant is helping fund scholarships and programmatic support for students who come from underserved urban and rural areas in the Commonwealth of Kentucky. And already we've been able to award more than $1 million of scholarship to help mitigate the debt of students who come from those areas. We know that students who have come from underserved areas are able to train in underserved areas, will be more likely to return there and have impact in their communities. So this is a substantial way for us to make an inroad into that area. We strengthen that both from our Louisville campus as well as our 20 plus year regional medical campus with the Trover Clinic in Madisonville, Kentucky. So really excited about the HRSA grant. Additionally, we have a great program that's another NIH-funded program called Kentucky INBRE, I-N-B-R-E, and we were renewed for $25 million in that research area. What does that do? That helps us work with students in undergraduate areas from regional universities such as Morehead, Murray State, Kentucky State University, and others to have science experiences and credible work that can lead to publication and health impact in research. This also is an opportunity for students to visit our campus and interact with our campus. There's also a program at UK, but the students who visit our campus have an opportunity to see our science facilities and our health professions facilities. Therefore, that brings a group of students in who have high interest in being either clinician scientists, or perhaps PhD scientists in one of our graduate programs. We additionally have had exceptional ability to move forward with the Aging Innovation and Venture Studio through the Traeger Institute of Aging and the Optimal Aging Clinic from Republic Bank. This is really a massive improvement for us. We know that Louisville is a hub and Kentucky is a hub for aging. And this grant establishes a portfolio manager that will help our researchers who are doing work in the area of aging be able to also make connections with healthcare industry and to promote economic development in the school. It additionally allows for there to be research and educational opportunities for our learners, all the way from pre-matriculation college students to our medical students to our residents and fellows, as well as graduate students. We've had multiple NIH R01 awards and have increased those and placed increased intensity. We are one of 81 Carnegie R1 community engaged universities in the United States. To be a Carnegie research university, you must fulfill two metrics. We're measured by two things and two things only, and that is the amount of extramural grant funding and the amount of doctoral degrees that you confer. The School of Medicine actually is responsible for about 75% of the research that is done at the University of Louisville. So we have a lot of impact on the overall outcome of the University of Louisville. And we want to be a stellar research university that has major community impact. Additionally, we've enhanced our post-award management system, and that is to help our researchers manage grants and awards in an efficient, compliant, and appropriate manner. And this is really a key to be able to recruit and retain excellent faculty and research. We've additionally done many space renovations, including to our instructional spaces, our laboratories, and I've already mentioned the new building, which is occurring. One of the really big space innovations we're proud of is that we've recently upgraded our entire vivarium, which is the animal research laboratory for the entire University of Louisville, which is housed in the School of Medicine. So next slide, please, Ken. So I'd like to tell you a little bit about some of the initiative updates in 2024 that are really pretty exciting. And these include some engagement things regarding research. Some of these things are specific to the School of Medicine, and some of them are related to the health sciences campus in general. First of all, we're on a significant exploration with Murray State University in a regional partnership to potentially place a regional medical campus at Murray State University. This would be with collaboration with community and hospital partners in West Kentucky, particularly in the Jackson Purchase area, involving specifically Paducah and Murray. We're very excited about this two-institution initiative, and I'll tell you more about that as this evolves, but we're excited about that development and have great engagement from both universities as well as our community partners. We additionally have been working in collaboration with Norton and Ponce University. Ponce is an accredited medical school in Puerto Rico, and because of the damage of the hurricanes, they've not had significant or sufficient clinical placements for their students. So we're working in a partnership with them to provide some pediatric placements in the Norton Health System that will not adversely affect our students in terms of taking any placements away from them. This would be a growth strategy, but it would also be a community partnership. And as many of you are aware, we have a quickly growing Latinx and Hispanic population at the university, in the city of Louisville and in the region of Kentucky, and having physicians who are adept Spanish speakers is going to be critical in our area and many areas of the country. So we are happy to have this partnership and to work collaboratively with our partners from this Puerto Rican medical school, which is now Puerto Rico's largest medical school. We additionally underwent a FTI strategic alignment exercise, and that was a consultation involving an organization called FTI, which is a Boston-based company, and that was to look at how the University of Louisville Healthcare, a related entity, and the School of Medicine could be in great alignment across our missions, such that we are delivering the optimal and best clinical care, excellent teaching, excellent clinically engaged research, and excellent community engagements and communications with our community. So that's gone quite well, and we've identified strategic service lines that include cancer, cardiac care, behavioral health, and neurosciences as areas for us to distinguish ourselves, where we're currently distinguishing ourselves, and that we could have the greatest impact on our community. Additionally, we went through a large funds flow reengineering project within the School of Medicine that allowed us to place logic to how we fund our mission in terms of teaching, research, clinical care, and community engagement or service work from our school. And that's been an effective project that's allowed us to much more greatly understand our cost and our allocations, and to make sure that we are preserving our mission by funding it appropriately. We are participating in a program called House Bill 200. House Bill 200 was an initiative in the Kentucky state legislature to increase healthcare workers or workforce. And this is not a situation that addresses dentists or physicians, but addresses nurses. So we are prepared to develop matching and placing an application in actually this month for a matching program for scholarships that will allow us to increase the number of nurses that we train in our nursing school that have, and they would have employment contingencies with our partners at both the University of Louisville Healthcare as well as Owensboro Health in Western Kentucky. So this is allowing us to have great impact on our area and rural adjacent areas in Kentucky to develop a more robust nursing workforce. We additionally are engaging with regional and local historical Black colleges and universities in interactions with pathway programs to encourage their capable students of applying to our graduate programs, our medical school programs, and our professional programs. Some of this work has included Simmons College of Kentucky, as well as Kentucky State University, Meharry Medical College, and an upcoming engagement that we will have with Morehouse in Atlanta, Georgia. There were several questions that came prior to beginning the address around artificial intelligence and how we're working on that. And I'm very happy to say that we have an artificial intelligence task force and committee that's been in place for well over 12 months. It's led by Dr. Sohail Contractor, our chair of the Department of Radiology. And it's looked at clinical and educational aspects of AI in medical education and in healthcare. We are using AI through our electronic medical record to enhance the quality of life of our providers by allowing them to shorten their time in documentation and actually to spend more face time with their patients. We are serious leaders in the use of AI in radiology applications through Dr. Contractor's work and through Dr. Gondam's work in the Department of Pathology. We're enhancing and growing our work in digital pathology and the use of AI algorithms to increase the accuracy of tumor and cancer diagnoses in pathology assessments. So next slide, Ken, please. So I want to talk a little bit more now about strategic priorities. And as we shift gears and talk about our strategic priorities, over the past several months, we have finalized a 3-year strategic plan. And many people were able to look at our draft of the plan, which was posted online, and we received public commentary and feedback. And we adapted and incorporated much of that feedback. And I thank those of you who had an opportunity to see that and provide us impact. During the next few slides, I'm going to really discuss some of our strategic plan. And this is along our strategic pillars, of which there are 4. They are called Learn, to talk about our teaching effort; Discover, with respect to our research effort; Connect, with regards to community engagement; and Work, and that is facing our internal environment and our workplace environment, and how are we optimizing the workplace environment for learning and research and clinical care, and combating things like problems with wellness, fatigue, burnout, and other stresses that face this modern medical system. So in terms of Learn, one of the things we really are working hard at is creating alignment to showcase how our distinctive education prepares future physicians and scientists to advance the human condition. So by being a 4-school proposition, we are doing a lot of transdisciplinary and interdisciplinary work between the School of Public Health, the School of Medicine, the School of Dentistry, and even the other schools in the campus of the Belknap campus of University of Louisville, with increasing engagements with engineering through bioengineering projects, including nanoparticle and nanomedicine, as well as work with the Arts and Sciences College regarding particularly psychology of eating disorders in pediatric patients, for example, and with the Kent School of Social Work along producing providers that have specific abilities to address behavioral health needs, from everything from cancer patients to rural delivery and telehealth delivery of behavioral health tools. So very important and exciting initiatives. We're also developing advanced learning tracks that provide distinctive career opportunities. And this would include examples like our business and research tracks, but we have many tracks, including tracks that deal with health equity and other topical areas, that allow our students to not only fulfill the complete curriculum that's necessary for accredited medical schools and for excellent medical schools, but this is additive elective material that allows them to develop additional competencies in areas that they have great passion about. This has been a great recruitment tool for our school, and I'll tell you a little bit about our admission statistics a little bit later in response to one of the questions, but this has been an exceptional way for us to really engage a highly diverse and excellent group of students in our medical school. We want to enhance the success and support services for all of our learners. The pandemic showed us one thing, is that it was a stressful environment in which there was not a lot of interactive learning other than online learning. So many students who didn't have the ability to have as robust of interactions or robust science training have begun to wash up on the shores of higher education, and therefore even medical school. So we are working very hard, and partly through the HRSA grant and other initiatives, we've increased the number of learning specialists in the medical school and the tutoring program to assure our students can develop mastery over the academic material that is required and is so rigorous for medical school. We additionally want to enrich learning experiences and empower the constituents to be at the forefront of technological advancements through generative AI. And I talked about some of our programs in radiology and in pathology specifically, but we're integrating AI into the curriculum in a horizontal manner in every way we can. We also have to be mindful about AI, and we're quite aware that we don't want this to be used in a nefarious way or a way in which there are ethical or professional issues. So we're going to include that ethical and professional education and certainly monitoring and guardrails around AI. But it is a tool that is coming and is here. So we want to adopt it. We want to be early adopters, but we want to be mindful and thoughtful of both the good and potentially bad aspects of AI. We want to offer opportunities for leadership development for all learners. It's very important that our learners learn how to effectively work in teams, learn how to work in advocacy situations, and learn how to work really across the board. And we've used our own faculty, but additionally have been highly engaged with the Greater Louisville Medical Society, as well as our Alumni Association in experiential learning and leadership opportunities for our medical students. And we want to prepare learners and educators and faculties for the healthcare system complexities of the future. And I think a lot of that is around the idea of quality and safety and teaming. So the large sim center that we're going to build in the collaboration hub and our current simulation efforts and our current educational efforts are really centered on how the physician can lead the healthcare team and how you can be an effective leader in those circumstances. We additionally want to prepare learners and investigators for the complexities of research environment. So our graduate students, we want to have them able to have leadership training, advocacy training, and also learn how to work in team science in a transdisciplinary way. We've established early investigator grants that help people, that in fact encourage people and incentivize people to work in a transdisciplinary and cross-disciplinary manner to answer some of healthcare's most vexing problems. So next slide, Ken. The other thing that I'd like to really talk about here in Discover, which again is our research parameter, is that we really want to build and enhance our infrastructure to support U of L research, scholarship, and creative activities. One of the things that has been really critical and wonderful local support through organizations like the Jewish Heritage Fund, which has helped support our core laboratories. Many of you hear about the omics of science now in medicine, so genomics, proteomics, etc. And there are many others, metabolomics, cardiometabolomics, and how we interact with metabolites in our foods, environmental sciences. So many areas that are core to healthcare and have impact on disease outcomes. So we are growing that infrastructure, and we are really investing both institutional dollars, enhancing our grant applications, and really making this a cutting edge scientific medical school. We additionally are investing in the recruitment and development and retention of our top researchers, faculty, staff, postdocs, and graduate students. And we, for example, increased our graduate student stipends so that we became very competitive in the market with regional schools and are able to enhance our population of graduate students. And we are seeing the early impact of that, both in terms of achieving excellent students and increased numbers of students. We also want to expand innovation and translational research support, including clinical research and clinical trials. I told you a little bit about our CTRD grant already, but additional areas that are helping with that is we are putting in funding this year to increase our MD PhD program. Another form of NIH grant center funding in the IDEA state area is what's called an MST grant for MD PhD programs. We have grown our MD PhD program from 2 MD PhD candidates per year to 6 this coming year during my time as the interim dean and now dean in EVPHA. We're very proud of this program, and we want to be known as a center that helps develop highly impactful clinician scientists and ones that will stay in this region and continue to make impact in Kentucky and the area for a long time to come. As most of you know, health outcomes are not optimal in Kentucky. We have among the highest rates of cancer, cardiovascular disease, obesity, liver disease, biometabolic diseases such as diabetes and other problems that we have to make some impact on. And it's the responsibility of our medical school to lean into those problems and to have our students embrace those problems and help move us forward as a society and as a commonwealth. Next slide, please. So Connect, our community engagement. We want to recognize and celebrate the works that empower our communities. We want to engineer our future economy. We want to have economic development occur because we are bringing industry and partnerships to Kentucky, not only Louisville, but also rural adjacent areas and areas that we're at So we have scientists and businesses wanting to collaborate. We have numerous collaborations with the business school. One of the most exciting ones I would point out as an example is what a bioengineering and medical school collaboration that we have with our medical students that involves the business school, the medical school, and the School of Business. And this exciting program is one that works on an annual basis. It's in about its fourth year of iteration. And the groups that work together or teams that work together help develop medical devices, medical apps, and AI driven apps that assist our patients or assist physicians in their daily work. And it's been a very generative program. We want to advance health and health equity. We realize that marginalized populations that include rural America, as well as certain areas of urban America, have not had the health access that they need and not had as robust a health outcomes. This is an opportunity for us to research and leverage the whole university, and especially the medical school and HSC schools, to make healthcare better for everyone in the Commonwealth and the region. We want to create opportunities that bring people to campus and bring the campus to people. So what I mean by that is we want to communicate our stories better. And I thank Tanya Shive-Augenstein, who is our Office of Communications and Management leader, and her staff, that you're going to hear from us a lot. And we want to hear from you a lot. So we can not only tell the great stories of our alumni and tell of the impact that we are making through our students, our staff, and our faculty to improve the health of our community. Next slide, please, Kent. And work. It's not really the brick and mortar that makes the medical school. It's the people who are there. And the people who are there, as many of you know from your days in medical school, one thing that hasn't changed is the fabric of the medical school is often our staff and certainly our faculty. And we want to recruit and retain the best and the brightest. We've recently done a considerable amount to improve the compensation of faculty and staff, but we're not done with that. And that's always a challenge, to remain competitive in the market and to attract the brightest and best people and to keep them. But we are intentionally working on that, and we have improved that situation over the last 12 months and will continue to endeavor to make it even better. We also want to recognize our faculty, celebrate our wins, celebrate the great things that we're doing. So you will see us doing more and more with that. We also, I would give a shout out to Dr. Glenn Giddings, who's going to ask me some questions in a few minutes, or be the voice of the audience, if you will. And Glenn has done work with our staff to enhance the smart staff engagements, work with our staff senate, and make sure that we have an excellent shared voice of the staff, the fabric that makes our medical school and HSC work the way that it can and work even better. So I thank them. I thank all of our staff for the hard work that they do. Next slide, please, Kent. So I want to thank you very much for this opportunity. I'm so humbled to serve as an alumnus of this School of Medicine, as the Executive Vice President for Health Affairs and Dean of the School of Medicine. This place means a great deal to me. This is my 30th year, starting on the faculty in 1994. And this has been my only academic appointment since I have finished my fellowship in head and neck cancer surgery at the University of Pittsburgh Medical Center. So I feel honored and humbled to be here. I deeply care for this place. I'm very thankful to work with Dr. Kim Schatzel, our president of the University of Louisville, who I believe is a highly motivated individual with great integrity, who has a great vision for our university. So these are exciting times for the university and exciting times for the School of Medicine, and I appreciate the opportunity to interact with our alumni tonight. So Glenn, I'll open it up to any questions, and we can address some of the items that were brought up.
Absolutely. As we remind you all, there is a Q&A section here in Teams. So if you've got a question, you can feel free to drop it in there, and we will address it as they come up. In the interim, we had some folks who had some questions, and they submitted them beforehand. So I figure I'd start with some of those, Dean Bumpous. And
Yeah, that's great.
You alluded to some of them. So could you tell us about this year's incoming freshman class, makeup, where
Sure.
everyone's from, all that, and how much tuition is for the year?
That's great. So, I think that what I'm really excited about there is we have 165 students that we brought in. I was able to be with them quite a bit during orientation week and during what we call our white coat ceremony, which invited them in person with to receive their first white coats, which were graciously donated by the Greater Louisville Medical Society, one of our most highly engaged partners who's done so much with us from scholarships to this white coat program, and that's just touching the tip of the iceberg. So shout out to GLMS. But let me tell you a little bit about this class. So there were 120 from in-state, 45 from out of state. And the students come from 18 different states across the United States, from California to Florida and Pennsylvania to Texas. 22 students are from rural counties in Kentucky. So, very proud of the fact that we are leaning into rural health and we are trying to really prioritize bringing people to Louisville who are from rural areas, as well as offer placements at our Madisonville campus. And then students come from 67 colleges and universities across the country. Our largest group of students is from the University of Louisville, and that was 47. And that's followed by the University of Kentucky, which was 16. But let me give you a little flavor for the breadth of the colleges that our students came from in this class. They come from Boston College, Centre College, Indiana University in Bloomington, Harvard University, Loyola University in Chicago, Michigan State University, St. Louis University, Transylvania University, the University of Cincinnati, the University of Iowa, the University of Miami, Villanova University, and Western Kentucky, among others. The one thing I didn't say earlier, Glenn, and I really meant to, is that 165 students that we admitted and are currently matriculating in our first year of medical school class was from an applicant pool of 5,000 people. 5,000 people. So med school is still a very competitive entity. It is still a highly sought after career. And I think that really bodes well for our future. And this is a high quality class, and we're really excited about them. They represented 26 majors. The largest and most predominant major was biology, but it was followed by others, including anthropology, biochemistry, biomedical engineering, neurosciences. We have a new undergraduate neuroscience a bachelor's degree program that is actually run out of our Department of Anatomy, Anatomical Sciences, and Neurobiology. And that's become a very popular major at the University of Louisville, and it's become one that we have received some exceptional students through. They've also had majors in psychology and public health. So very diverse set of majors, but a really excellent class. 49% of the class identify as women. And then 23 of our students were considered non-traditional students, meaning they were in an age group of 27 or older. And those typically are students who may have obtained master's degrees or other advanced degrees prior to joining medical school, or were in the workforce and then entered medical school later. The average GPA, undergraduate GPA of the class was 3.7. So that's the basic demographics of the admitted class. I think it's very interesting. I can tell you it only tells part of the story. They're exceptionally excited. They're really motivated to be here. They really want to be a positive force in the world. And they've given me a shot in the arm this week, just in the last few weeks, getting to know them better. And I'm very encouraged by this group. It really is hope for our future.
And that final part of the question was tuition for resident, non-resident.
Yeah, I apologize.
It's
I didn't get
right
the
around, I
figures
took a
there.
quick look. It's about
Yeah, thanks, Glenn.
44,000
Right.
for Kentucky residents, 67,000 for a non-resident
And
per
we
year.
did, I would say this past year, we did a modest increase, but not much. And, I'm very concerned about that. And it may lean into a future question that was asked about debt and financial problems, Glenn. So maybe I'll skip ahead and talk a little bit about that now.
Go right
One
ahead.
of my goals with the president and one of my greatest concerns, and it should be a great concern of any medical school dean right now, are financial mitigation strategies. The average, according to the AAMC, the average medical school debt upon completion of medical school for medical students is $200,000. And for the University of Louisville, ours is a little higher. It's about $250,000. So we've done some really important things. And I gave a shout out earlier, for example, to Greater Louisville Medical Society. They started a program for our scholarships for medical students a number of years ago. It started as a very modest program involving about 5 students, maybe about $5,000 a year. They've grown that to be more than 12 scholarships of $12,000 this year. And they support this mostly from a charitable golf outing that many of the medical school faculty and people in the community participate in, health systems participate in, but that program's grown considerably. We are additionally the HRSA grant that we obtained that I referred to that was $16 million. A significant, at least probably 45 to 50% of that grant is centered around meeting financial need for our medical students. So are we where we need to be with that yet? No, and nor is any medical school in the United States unless you had the Michael Bloomberg give you a gift, which many of our medical schools across the country, I'm being a little facetious there. But what I'm saying is it is on our radar screen. It's a great concern of mine. And I want to do everything we can to make sure we're graduating people with less debt.
So you had alluded in a series of things that we've been working towards and centers and institutes that we have. You'd alluded towards metabolic components and growth opportunities. So one of the questions are what are the opportunities for emphasis on metabolic physiology?
Well, I think there's a lot. I think two of our strongest areas of research include environment. So part of environment and our Envirome Institute, the university's largest institute, does have to do with nutrition and food intake. It's a part of our environment, part of our ecosystem. And how does that have impact on disease, such as cardiovascular disease, cancer, and other things? So we're definitely working on that. Our new Dean of Public Health, Dr. Katie Cardarelli, is very interested in areas where there are food deserts and food inequities, and how can that actually affect disease incidence and disease outcomes. So we're doing a lot with that. Additionally, I'd give a shout out to Dr. Kim Williams, Dr. Dinesh Kalra in our cardiology department and Department of Medicine, and also to Craig McLean and others who are doing a lot of work in cardiometabolic research to look at not only dietary factors, but also metabolic factors such as the new GLP-1 inhibitor medications that are kind of taking off like wildfire. What are the best applications for this? What are the best outcomes for this? Where should we be with this? So while they are very encouraging early results from those medications, there are still a lot of questions and perhaps a lot broader applicability even to the areas of behavioral health. So we're looking at those sort of things and are very deeply vested at it. Look at, particularly in the research arena, but also in increased education of our students around the notion of how does your diet affect your health? How does the air you breathe affect your health? If you guys follow LinkedIn or any of the social media things, you'll see I kind of amplified a release from our Envirome yesterday, and that had to do with the tree canopy. Where how many trees do you have around your house might impact how well your blood pressure is controlled. So there's really some innovative things that deal with not only diet and nutrition, but the more holistic view of our entire environment and how it affects our disease outcomes and our health. And we're really involved in that in a very big way.
Again, I think you touched on some of this a little bit earlier, but definitely let's dive into a little bit more. What is U of L doing in the way of educating students in the use of AI in diagnosing and treating medical, surgical, and psychiatric conditions?
Yeah, I think everywhere from developing more AI protocols. We're struggling with how do we initiate it. We're using a program called Dimensions now for our researchers and students, where they can actually canvas and see research networks across the country that are working on particular problems. We're having them integrated in using development of of differential diagnoses in their clinical diagnosis course, for example, but also teaching them about the fact that there can be what are called AI hallucinations or AI references that aren't really real. So, AI without critical thinking on the part of a physician is potentially dangerous. AI with critical thinking and good critical thought skills can be an amazing tool that would enhance patient education, research, and many things. So, we're looking at it cross sectionally in education, in clinical care, and in research.
All right. I think you also touched on some of this, but one of our alum was really concerned about overall nationally the loss of infrastructure and physicians in primary care. So, wondering if
Mhm.
there's opportunities and how you see the importance of primary care currently and in the future.
Well, absolutely. I mean, we've really worked hard to enhance family medicine. We have three family medicine residencies that are officially part of us, and one that's an affiliated family medicine residency. So that includes our program in Owensboro, Kentucky, in Glasgow, Kentucky, in Louisville, Kentucky, and in Madisonville, Kentucky. So we're trying to train postgraduate primary care physicians, particularly in the rural environments. We know we need to do also urban environment work on that. And so we have now a primary care clinic that is in the west end of Louisville that allows people to understand the health problems that occur in a neighborhood such as the Russell neighborhood of Louisville or other neighborhoods of Louisville. And we're fortunate to have some highly engaged faculty that are doing that. We have a compassion clinic that allows our students to interact in some of those areas as well. The HRSA grant that I alluded to earlier is really focusing on training primary care physicians that lean into both rural and urban underserved areas. So it is definitely part of our strategy and part of what we want to enhance. We don't only want to be, and it's not sufficient to be just an R1 and just a highly specialized and only scientific university. We want to be that and a place that generates primary care and addresses the workforce needs. If you heard our president talk very much, she often talks about the good to great aphorism of the tyranny of the or. You can be either a primary care medical school or you can be an R1 medical school. I really reject that hypothesis. I think that you can lean into both of those issues and you can be credible across both of those domains. And that's what we intend to do.
Gotcha, gotcha. A question on when we talk about your vision and overall thoughts of where we may go. How does that connect to Cardiovascular Institute, some of the work that they're doing, and just overall cardiovascular as a whole?
Right. Well, we all know the expression an ounce of prevention is worth a pound of cure. So, I made a reference to Dinesh Kalra and Kim Williams earlier, but I think it is very important. We have coronary artery calcium scans now. So, how are we going to make sure that we get those things out there? I think a little bit about the fact that we know in the state of Kentucky, for example, low dose CT scans are a great way to survey lung nodules and identify earlier stage lung cancer and therefore have better outcomes in lung cancer. Well, the same thing with these cardiac CT scans that Dr. Kalra and Dr. Williams are working on to try to really prevent second events and to identify coronary artery disease early and to make sure people have nutritional and biometabolic interventions that can help them reduce their cardiac risk. Dr. Williams, for example, if he were here, he would tell you he's very interested is a vegan diet better than a Mediterranean diet with regards to doing that? And are there population differences or other things we do? And how do we integrate that with current therapeutics such as statins and other medications like GLP-1 inhibitors, which could potentially slow the rate of plaque formation or even reverse it to some degree? So I think we're very involved in that, and that's a high priority. As I said, one of our strategic service lines that we're emphasizing is cardiac and cardiology. We have a cardiac service line board that includes research, community engagement, clinical, and teaching components. That board meets monthly. It regularly reports out on metrics in each of those areas to determine that we're on course and that we are actually intentional and that we're continuing to work in a positive manner in that regard. There are a lot of details behind that, but I think we're very active in that space, and we very much think those are important parts of who we are.
Since this is really broadcasting to all of our alum, and that could be across the country, even across the world, some may or may not be familiar with LUMED. I didn't know if you could give a good overall explanation of LUMED and then some of the already early successes it has had and some
Great.
future opportunities.
Yeah, thanks, Glenn. It's great. And LUMED stands for Louisville. It's LOUMED, all caps. It stands for the Louisville Medical and Education District. It's 22 blocks that encompass the downtown medical center. It's a neighborhood association. And it was established, it began its planning over 2 years ago, established at least 18 months ago. And it's really in its official major launch this past year. Its partners include the University of Louisville through the School of Medicine, and I represent the LUMED board for the university. It has U of L Healthcare, our related entity, and then our partner Norton Healthcare. And Norton is our affiliate for pediatric healthcare in all specialties. And the Norton representative is currently the CEO of Norton Children's Hospital. So this is a very aligned group. And then the third partner of that is Jefferson Community College, or Jefferson College, and President Ty Handy is the representative on that board from Jefferson College. And that's really important because a number of their students go into health, paraprofessions, and professions. So the ability to take that 22 block area, including Chestnut Street, including Abraham Flexner Way, and to make it a safer, more attractive, and more conducive space for students, patients, staff, and really to improve the quality of life. An early project, or a couple of early ones, Glenn, that are of significance is the former correctional facility of the city that was across Chestnut Street from our offices in the Able building is being razed and taken down, and that's being developed into LUMED Gardens. And this will be a state-of-the-art garden and park that is actually programmable space, and it will really improve the downtown posture. Also, LUMED has a contract and has developed a program to integrate security services between all of the partner entities. And we've also hired a company called Block by Block who helps clean our campus of all types of trash and material, tons of trash a month. They also escort students and staff to enhance safety. And they are actually, and they've really been a very humane force there because they do a lot of direction finding, and that's great. We have an almost $20 million appropriation that has come from the state and perhaps even increased federal appropriations that are going to redo the entire streetscape of Chestnut Street. And we hope to do that fairly quickly. Behind that, the Abraham Flexner Way that runs in front of Jewish Hospital, behind the Children's Hospital, and traverses really theoretically all the way over to our CTRD building, or our CTR building, Coast-Air Clinical and Translational Research building, on the eastern border of our campus. The people who are doing this is patterned after people who have done the reconstruction of places like the Longwood campus for Harvard's medical school. So we are working with premier firms. There are almost over $700 million of economic development that are occurring in that 22 block area over the next couple of years. So the city, the state, the federal government, community partners are really looking to this to be a significant advancement, improvement, and a thoughtful way to grow our medical center. And it's a really exciting time for us. And LUMED is going to be a positive thing. And I hope to give you even more outcomes and data on good things that we're accomplishing and things that LUMED is considering.
Yeah, I want to make sure we helped explain that to a lot of folks who don't sometimes get on our campus every day and see the connectivity and the impact of those LUMED ambassadors and the collective work of all four entities, sometimes we're competitors, sometimes we're collaborators. So it's really neat to have that connection. So I want to make sure we highlighted it. That wraps up all our questions. I myself just want to give another shout out to the School of Medicine Alumni Council. They've been fantastic. If you've ever thought about being a part of our alumni council, it was reconstituted, really only coming into the third full year. And they've gotten legs quick. They've made impacts. They're already doing engagement events with students, with residents. They're connecting with our local medical society. They're putting on CME events. I mean, they're really being very active, very quick. So, and here's the great thing: they're from all around the country. So we've
Yes,
got Zoom capabilities. Those meetings happen, so you don't have to say, "Well, I'm not there in Louisville." So if you ever have an interest, feel free, reach out to us. We would love to have you consider being a part and doing some of the great work that they're doing. So I'll turn it back over to you to close
great.
out.
Yeah,
And we
Glenn,
thank
I
everybody.
absolutely appreciate those comments because I think our alumni are vital. And, you know, the old adage of time, talent, and treasure, many of our alumni are highly engaged in this current alumni association. I couldn't ask for a greater group of officers and people. They are working in such stalwart fashion to advance this school, and they really take it very seriously. And I would really encourage alumni to engage with the Alumni Association. We also want to hear from you. We want to hear your stories. We want to hear what's happening from you. So again, we'll place some links and materials. Look for communications from us and reaching out to you. We also welcome you to our campus. Come see us and come look at the campus and come observe the changes that are occurring. Uh, Greatly appreciate this community. One of the interesting things I've learned is we have probably over 70,000 medical school alumni out there. And in our email listserv, we probably have about 40,000 that regularly engage with us in some form of communication. So we want to really, that's a powerful group. And your insights, your practice in medicine, the impact you've had in your communities, and the wisdom that you've collected over time is important for us to know and important for us to hear about. So we really are excited about that level of engagement. And lastly, I would just like to say thank you for the many, many kind notes, cards, and communications that I've received since I was established as the Dean of the School of Medicine and EVPHA. I really appreciate the kindness. I take the job very seriously. I'm greatly humbled by it. I'm very passionate about this school, and I will do my level best to live up and be an outstanding dean that cares deeply for the school and cares about its long legacy. As the ninth oldest medical school in the United States, the 1828 being sort of our official start date, but we probably had unofficial start dates that even preceded that. University Hospital and all of its iterations since the Marine Hospital celebrated its 200th anniversary. We have endured. We have endured. We've shown resilience. We have been tough, and we've continued to educate excellent students. And I'm so encouraged by the current class that we have is that we have a bright future and that we have an obligation to help others and help our society, which is our true north as a compass. So I appreciate all the impact all of you have had as physicians out in your communities. I hope you have endearing feelings and thoughts about the University of Louisville School of Medicine, and we look forward to interacting and communicating with you more and regularly. So thank you.
All right, with that, we will conclude today's address. We thank you so much. And as Dean Bumpus said, please let us know. Let us hear from things that you want to connect with. You all have a good evening.
Good night.